I will be discussing Stevens-Johnson syndrome. What is Stevens-Johnson syndrome? It's a severe immune response mediated hypersensitivity reaction to particular drugs or infections that causes a rash, sloughing of the skin, and a disruption of the mucous membrane. Some of the anatomy that or a system that is affected would be the eyes, abdominal, the breast, the immune system, your hands, your head, your nose, the neck, and urinary system. Some of the lab that the doctor would order, the doctor would diagnose the patient by a physical exam of the skin and medication. He would also order CBC, blood cultures, and wound cultures can be detected for monitoring infection. The cause of it is hypersensitivity to infections and drugs. The symptoms would be fever, headache, cough, rash, blistering. The duration lasts minimum of 2 to 3 weeks. Rashes last 1 to 6 weeks, and the recovery can be very long. The treatments and the intervention and education. For the treatment, discontinue any of the offending drugs, intravenous fluids and salts, system management, treatment, or secondary infections. Monitor the vital signs, respiration, level of consciousness, maintain airway, and promote good hygiene. Reposition gently to avoid injury to the skin, NPO due to the blister or difficulty swallowing. Avoid spicy foods. Educate client to report any signs and infections, such as redness, swelling, and temperature. Encourage fluids. Educate client to take antibiotic as prescribed. NCLEX question: what is Stevens-Johnson syndrome? A. Immune response mediated hypersensitivity reaction to particular drugs. B. A bowel problem. C. A condition that is deficiency in vitamin D. The correct answer is A. Immune response mediated hypersensitivity reaction to particular drugs. Rationale: Stevens-Johnson syndrome is usually a reaction to a medication or infection. Another NCLEX question: the nurse is performing an assessment on a 10-year-old child suspected to have Stevens-Johnson syndrome disease. Which assessment findings are specifically characteristic of this disease? Select all that apply. 1. Fever. 2. Headache. 3. Cough. 4. Rash and blister. 5. Vomiting. The correct answer are 1, 2, 3, and 4. Rationale: Stevens-Johnson syndrome signs and symptoms includes fever, headache, cough, and rash and blister. It's caused by a reaction to medication or infection. And this is my reference. Thank you.